It's a little dark in here, but anyways, I don't know what I'm gonna do because I just I can't stand things aren't really getting any better. Um, I mean, I had some slight improvements, like in being able to move around, but like not much. Um, there's no way that this picl I had is gonna be enough. I probably need like 2 or 3 more, maybe 4 more. And um, the doctor, Virajampa, is very likely not gonna um, do any surgery on me because the imaging that he ordered the testing he ordered is not adequate to diagnose CCI patients. Like he ordered like lumbar and a head MRI and like a lumbar puncture, like in addition to the lumbar MRI. Um, well, I don't have any symptoms of CSF problems like spinal cord fluid issues, pressure, or anything. And I got the lumbar puncture Wednesday, and of course, it didn't show any problems. Um, I don't have any symptoms of tethered cord. Like, it's not hard. Like, I felt and heard a tear, like right around my C1, and then this happened. So it's like, I tore my C1 area. I tore transverse. I tore longitudinal. I tore my alar. I don't know what like posterior longitudinal it was that I heard, or the alar that I heard tear, but something tore, and I heard it and I felt it, and I hear grinding again. Like if I go like if I sit up, I hear like grinding and popping around like my C1, and I feel like like if I do anything with my head, I get vertigo, and like if I try to like look at something like if I use my neck at all, really, like if I lean forward to do anything, it's bad. Um, the atrophy doesn't help because I haven't used the muscles like that to like lean over, but it's like clearly like my head's not being supported because like if I just like gently like push on my forehead just to give me a little stability, like my symptoms like greatly improve. So it's not like I need a ton of stability. My ligaments just are not giving me that little bit of like holding things in place I need. They're just not doing that much. So like you can have not a complete tear of your ligament and you can have major problems because it's not functioning well enough. And so yeah. Um, so I was looking into Pegasos euthanasia because I can't get help for this problem, and I can't afford like if the regenerative therapy was covered by insurance and I could just keep getting it as much as I need, I'd be fine. It would stink that I'd have to do it and go through that process, but like, and I don't know what's going on with me, like why this happened. Maybe I did just injure myself and my connective tissue isn't that bad, or I don't know, maybe I do have Lyme disease. I'm still waiting on the test results for that, but it's not covered by insurance, and that's the only treatment. They're the only people that'll treat me, and they treat me. They're like when they treat me, when regenexx treats me, like, oh yeah, your ligaments are really messed up, because they inject me, and they're like, yeah, these are bad, and and then I have significant symptom improvement when they do the injection. So clearly, my ligaments are the problem, because when they're getting repaired, my symptoms improve. Um, my muscles are fine, my vertebrae are fine, my neck curve's not great. I'm trying to improve that. Like I had um I had that like deep rumbling, like wah wah, like in my left ear, especially when I would lean forward, uh, or like move my head suddenly in a direction, or even open my mouth. And And I started doing stretch it, like I started doing more like I have an adjustable pillow, so I roll it up. It's like shredded foam inside, so I can roll up the pillow. It's not like a solid foam piece. I roll it up, stick it under my neck, and lay on it. And it's like doing curve correction on my neck like 15 minutes a day, and then so that's greatly reduced. It's pretty much like I don't even hear it now at all, like that deep rumbling sound. And I haven't really heard it much at all today. And my jaw, like I was having the clicking sounds in my jaw, um, and I was opening my mouth uh, and so I'm relaxing the jaw. Like once I open it a little bit and I pull it the rest of the way and just hold it at like a gentle stretch with my hand, but I'm relaxing the muscle. I'm not using the muscles to hold my mouth open. And then, for like 10, 15 seconds at a time, and I'll do it like 5 times a day. And then this way, like left and right, I also do 10 seconds like each direction. And my jaw's been popping out of socket much less. So I think the muscles were so tight that when I would open, it would just yank everything out because I wasn't really talking or opening my mouth much at all for months. And I think everything got really tight. Um, Same for like my neck, like everything in my body that hadn't been moving has gotten real tight. Anything I haven't used, so that's helped a lot. But yeah, I've still been looking into euthanasia just because I don't want to live like this anymore, and nobody gives a shit. Neurosurgeons won't operate on me, and I can't afford any more regenerative therapy. So I'm gonna live like this until the day I die, and I don't want to live that way.